Good evening everybody, it's Dr. Cormac here in Belfast. I've been receiving some inquiries with regard to my own CRX journey, and so therefore I've decided to do a small snippet of a quick demonstration of one of my evening routines. Obviously the main objective for my particular skincare journey was first of all that during the lockdown I became very complacent. I was sort of out of routine. Sometimes I was doing things with my skin, other times there were long periods where I wasn't because I simply wasn't going anywhere, or I was in work in hospitals where it was quite dry and warm, and with PPE etc our skin takes a bit of a reaction to that. So during lockdown Obagi have come up with another new product, which is the Professional Microdermabrasion paste. And this is a Professional C product, which is really important because it contains 30% of ascorbic acid, which is really important because it's 100% bioavailable when you put it on. This really deep, rich infusion will really help to brighten your skin. It also helps to improve the quality of your skin, but most importantly, it's really good for hydration. And particularly in lockdown, what better way to spend an evening than when you can't go to your local spas or your facial aesthetic treatments, that you can have a home pamper system like this. And of course, always important to have a little gin close to hand when doing this. So basically I'm going to take you through the steps in order to do this little mask, and then I'll quickly talk through the benefits of it and what other adjunctive products that I would use on a night that I use the mask. So the mask can be applied 2 to 3 nights a week. Again, really important because it causes exfoliation, so it's important to consider with your healthcare professional what other exfoliants or what other products that you are on for your skin, because they may need to be manipulated prior to or after using this particular mask. Also, if you're having in the future any in-surgery peels, you can see that at the minute I have to shave my skin, largely because working in the hospitals we have to wear masks. Luckily I haven't had many outbreaks, but certainly getting irritation around the neckline from skin, and probably in the coming days I will carry out a salicylic peel in order to try and heal those up and to try and improve them. The combination will obviously improve the quality of the skin, but my first focus in the past 2 weeks has really been about hydration, improving the brightness of my skin, also really starting to work on very superficial pigmentation because I have some of the tinges on the forehead. And next week, after having done maybe 2 weeks of really good hydration to the skin, I'm then going to start to introduce prescriptive products which will specifically address the pigmentation, and I'm going to update everybody on that as I continue to go through the journey. But so far I'm using Obagi everyday over-the-counter non-prescription products, and already I can see a huge difference to the quality of the skin. So the first thing I'm going to do is do a little cleanse with the Obagi C or X cleanser. This contains vitamin C, really nice cleanser, very good for all skin types, really good too for men because all of these products are not scented, which is important. So I'm just going to do a very quick cleanse. And we just pat dry. Skin feels good, smells good. So we don't want to over dry the skin at this stage. We just want to keep it particularly a little bit damp for the micro polishing paste to go on. So you get a little spatula with this. Actually smells incredibly good as well. We get a little polishing paste. So roughly about a quarter sized amount. This is no water, so it's actually quite a dry. We just like rub it between our hands and we just apply it. When we're applying this, this is 30% L-ascorbic acid. So what you want to do is it has got ultra fine little exfoliation crystals. So you just want to gently exfoliate the skin for about a minute. Sometimes when you're applying it, you will get a little bit of tingling, which is all pretty normal. Now, if that tingling, say for example, you're a bit sensitive, now because I've just shaved, I may be a little bit more sensitive than normal. But basically you just want to do a very gentle exfoliation. Just rubbing the crystals in. It smells so good. It smells really orangey. Then we leave this on for about 10 minutes to 15 to do its work. So I'm going to stop exfoliating at that stage and just let that do its work. So after about 15 minutes, when the mask, I've been able to tolerate the mask for a complete 15 minutes. So it is now time to remove the mask. And again, this is a really relaxing evening treatment, particularly before going to bed at night. You can use the polish and paste any time of the day, but obviously nighttime is always the best. This is a really rich infusion of hydration, of vitamin C to really repair damage to the skin, to try and improve hydration, act as, mopping up free radicals, etc. So it's a really good bedtime, pre-bedtime treatment. It's a good way to unwind, particularly after a busy day or a busy week. And again, it can be used with most of the Obagi systems, but you must consult with your healthcare provider who has got really good knowledge of the products in order to ensure that you're not over exfoliating the skin, and that to make sure that you know how to use it correctly. So when we're finished, all we do is we just damp a bit of the towel and then start to remove the products. And you can see how really glowing my skin is at the minute. And actually, it smells so good, you nearly don't want to take it off. It's just so fresh. Really nice feel to the skin. You can expect a little bit of redness, particularly for me because I've just shaved as well. So my skin will be a little bit more sensitive at this particular point. But it's just a really nice feeling, nice smell, quite soothing. Particularly at this time of the evening when you just want to unwind and you have a bit of time to yourself to do something. And just kick back and relax and just make the skin look and feel great. So this will really brighten the skin. It really will help to improve complexion. And as I said, so far on my particular journey, I've decided that I wanted to go slow, which is what I always advise my patients. And I also wanted to, first of all, address hydration. I've just finished 2 night shifts, so I feel today particularly tired. I also feel very dehydrated because when you're in the hospital, particularly at nighttime, unlike daytime where you might be drinking and doing different things, you tend to be in a very warm environment with very dry air. And by the time you leave the hospital in the mornings, skin is quite dehydrated. And then when you have 2 nights in a row or 3 nights in a row, particularly at the minute when we're wearing so much PPE and we're constantly having masks on and it's a little bit more humid because it's summertime, it can have an effect. So skin feels completely great, feels so smooth, feels super clean. Again, it will really help to hydrate over the course of the nighttime when you're sleeping. Some of the products that we then can use adjunctively, so because it's a bedtime routine and because it's nighttime, obviously always using the Elastiderm eye cream. Really important because the Elastiderm eye cream is a bimineral contour which basically will contain metallic compounds that really help to reduce the amount of dark circles under the eyes. And like I said before in the bio last week, because I do have a little bit of a hooded upper eyelid, I found that when I apply it on the upper lid, it really causes a firmness of the upper lid and it really helps with that, and particularly with hydration in the eye socket and just extending it out into the crow's feet area, particularly at a time like everybody during lockdown. If you're used to using maybe neuromodulators in order to prevent the movement of fine lines and wrinkles. That's a treatment that we currently haven't been able to avail of, and therefore these sort of additional skincare regimes are so vitally important, not only during the lockdown period, but also at improving injectable results, because these will always improve elasticity of skin, skin tone, skin quality, and therefore your injectable results are always going to be far superior. The other important compound that I use at night, which you may not be able to see here, is the Professional C peptide. So again, this is a vitamin C complex. It also contains, and basically I put on maybe 2 or 3 pumps. It also contains kinetin and zenatin, which are basically synthetic plant growth factors. And then I just blob these on and then rub it in. And again, peptides are really good to use at nighttime, because again, you're going to get the 8 hours of sleep where you can really benefit from these. And again, we would use, if it was morning time, I would be more maybe inclined to use the vitamin C serum. Pro C. And again, it just feels so smooth, so clean. And last thing, hydration. A little bit of hydrate. Sometimes I would use now at night time the Hydro Drops, which is a vitamin B3, hibiscus and also albicinian oil. And it's a fantastic product. Sometimes I use it alongside the hydrate. It just depends how much hydration that I feel I need. But particularly after an exfoliation mask, this is really going to help calm the skin, help to work in terms of hydration overnight. And where I have that little bit of redness, partly from shaving and also from the exfoliating mask, tomorrow morning when I wake up, skin will be tighter, brighter, smoother, and provided I stay off this, there'll be no headaches. Thanks for watching. Please join in for some more updates on skincare and also on the Obagi range. I'm going to do a focus spotlight on the Obagi Hydro Drops. Take care, see you soon.